Hello, I just listened to Volt founding team member Miki describing the beginning and story of Volt. The company was sold to DoorDash and it has been a huge success. I found a lot of similarities in this to our own journey. Greetings to Miki and Volt. At 73 Health, we have a professional board and we are following our growth strategy. Now it is time to take us to the next level. I will briefly explain what is the case here. You can also check out our other videos that go into details. We are disrupting the healthcare market. We change the way healthcare operates and challenge structures. Not exactly an easy equation, but if it would be easy, everyone would do it. Comprende? Changing the world requires a stunning vision of the future, sweat and blood that we know all too well. And even these are not enough. You also need to be in the right place at the right time and have an amazing team of experts and trust. The biggest and most expensive challenge in healthcare is still, guess what? It is the examination of the patient. The doctor must examine the patient to determine the diagnosis and treatment. Chat or video telemedicine alone are not enough for this. So the patient examination takes place in brick and mortar. Let's be honest, none of us would want to go to ER or medical center and wait in a waiting room full of sick people. Employers, on the other hand, would not want a chat or video doctor to prescribe sick leave without patient examination. And doctors want to be sure of their diagnosis and use proper examination tools. There is a lot of talk about artificial intelligence and all sorts of things about the digitalization of healthcare, but we are still tracking ourselves to the ER or medical center when we have a sore throat. Why can't only those with an acute emergency go to ER or medical center? Shouldn't doctors in the 2020s be able to perform patient examination remotely? What's the big deal about the doctor not being able to listen to heart, lung, and bowel sounds remotely? Why can't the doctor examine throat, ears, and nose remotely? Or examine eyes and skin remotely? I claim that there are not too few doctors and somehow suddenly too many patients, but rather that the examination methods used are old-fashioned. Healthcare resources are being misallocated. It is certainly clear that consumers want ease of use and convenience. Think about it. After all, we do not go to bank to queue and pay our bills anymore. We get groceries to the door and all the information is online. Which mother wouldn't want a doctor to perform an ear examination remotely straight from the home when child is crying over ear pain? Or when your heart feels like it is racing, wouldn't you prefer a remote examination from a doctor right on your own couch? Through painstakingly long work, we have been succeeded in building a cloud service that enables remote health examinations. Our solution is already tested and working in Europe, America, Africa, and China. Doctors estimate that demand will explode as everyone wants to remote doctor to examine them from their home. At the same time, we are building and increasing the business of medical centers, correct resources allocation. If currently only 10% of people experiencing symptoms have contacted a doctor, this is an opportunity to increase demand tenfold by offering ease of access. The global annual potential of 73Health remote health examination is calculated in billions. We have made significant new healthcare innovations, and they are funded not only by our company's 18 founders, but also by major public entities who see a huge opportunity in this. We are disrupting the healthcare market. This is going to be so big, it is going to be crazy. Change is always a great opportunity for investors and also for the top learning organizations that want to offer the best to their customers. Now our service platform is also available in your area. Thank you for your interest. Let's change the world together.
73Health, remote health diagnostics for healthcare units, workplaces, and homes.